Greetings, Dr. Mark Winton here from the University of Central Florida Department of Criminal Justice, and I'd like to spend a few minutes just talking about homicide, drugs, and COVID-19. So there's so much going on, we have to proceed with extraordinary care when we try to interpret the data and we start looking at trends and patterns and trying to figure out what influences certain increases or stability or decreases in criminal behavior. First, there's been a homicide increase occurring for a number of years, and I'll go ahead and I'll use the article by Rosenfeld and Fox, published in 2019, Anatomy of the Homicide Rise, published in Homicide Studies, volume 23, pages 202 to 224. So I'm going to rely on that study for the first part of the video, and then we'll look at some drug stats briefly and the pandemic. But basically, Rosenfeld and Fox, professors Rosenfeld and Fox, present their analysis of homicide changes and provide some explanations for the homicide increase. Now, the homicide rate basically has been declining for 2 decades, but then it increases in 2015 and 2016, actually over 20% over those 2 years. So the homicide rate was increasing prior to the pandemic. And historically, we saw an increase in the late 80s, and a lot of that was related to crack cocaine markets and gang activities. But now we wonder what is recently going on, what's driving up the increase in the homicide rate. If we start looking at some of the demographics, and I have those on the PowerPoint, but I'll mention some here, we see that that the homicide rate for blacks increased 24.4%, for whites it increased 19.1%. We also see that interracial rates increased with a larger increase of whites killing blacks. We see the female homicide rate increased 15.1%. The male increase was 23.5%, and for 25 and older it increased 22.5%, and the 18 to 24-year-olds it increased 22.4%. You really see some notable differences regionally. For example, in the Northwest, homicide rates increased 4.4%. The Midwest, it increased 55.1%. 55.1%. That is a huge increase compared to the Northwest. It's 4.4%, as I just mentioned, but also the West increased 18.6%, and the South 13.1%. So what's going on here? Gun homicides increased 30.5%, and argument-related homicides increased 21.5%. Drug-related homicides increased 33%. And, for our purposes here, we see that connection. For whites, drug-related homicides increased 55%. For blacks, increased 15.4%. Rural areas, it increased 141%. So we see a big increase, homicide increase among rural whites, and they believe that this is connected with the opioid crisis. So there's multiple factors going on, but it seems that a lot of these increases we see in different locations are related to drug-related homicides among rural whites using guns. So as we try to put, the picture together. Now, looking at the FBI data, we see in 2017 there's a small decrease, but 2018 to 2019, small increase. In 2020, increases. And 2021, it looks like we're going to see increased homicide rates again. As far as trying to put this all together with the social unrest we've seen, COVID-19, the opioid crisis, and what's been going on with policing, I think I'm going to not try to determine how influential those factors are, other than to say it looks pretty clear that the opioid crisis had a significant and profound effect on homicide rates the last several years. Now compound all that, we see other problems as well. And I just, for an example, I brought in the opioid overdose deaths in Cook County, Illinois. Basically looking at, and this is from the Morbidity and Mortality Weekly Report from the CDC website. This is from their January, this looks at January 1st, 2018 to October 6, 2020 data. This was published in 2021, and it's a report by Mason, Welch, Arankumar, Post, and Fineglass, and it's titled Opioid Overdose Deaths Before, During, and After an 11-Week COVID-19 Stay-at-Home Order. Cook County, Illinois, January 1st, 2018 to October 6, 2020. And it's published by the, as I mentioned, Centers for Disease Control in the United States Department of Health and Human Services. Basically, I have a chart that they provide looking at opioid overdose deaths in Cook County. And what you can see there is the increase that we have, before the stay-at-home order, and when the stay-at-home order is in effect. So we can see that, and then after the stay-at-home order, we see it starting to go back down. But what we have to do is consider all these factors, and that's been really, difficult to do. And we need to consider some things. For example, we need to have a better idea of how much crime was not reported during specific COVID-19 policies. So simply because there's less reporting of crimes doesn't mean that crime has actually decreased. Now, we may say that crime reporting has decreased, but we need to consider that what was going on with COVID-19. We also need to look at social unrest that occurred during the time periods, and we need to think about the social and psychological effects of COVID-19, and also how people adapted to these changes, looking at the stress, strain, and the conflict. So, there's a lot more going on. I have a report here I'm not going to go over, but this is from Professors Rosenfeld and Lopez from the Council on Criminal Justice, July 2021. It's called Pandemic, Social Unrest, and Crime in U.S. Cities, June 2021 update. So, and it's just, an amazing report to try to figure out what's going on. And it's very complex when you try to put all the pieces together. So this is a good time to reflect on how important it is for us to come up with specific policies to address multiple factors going on, such as increases in violence and homicide, increases in domestic violence, and the huge opioid problem that persists, and other drugs that are detrimental to health and have led to overdoses and deaths, and also the negative effects of COVID, both, or I should say, multiple effects: social, psychological, economic, employment, nutritional, whatever you want to analyze. There's really a lot going on. And so this is a brief video just to kind of demonstrate the complexity and how we have to consider all these multiple factors. And there's probably a whole bunch of factors I didn't address in this short video, but certainly would be relevant. And this wraps up this video. Thank you.